All right, let's now bring in Dr. Jacqueline Weyer, Principal Medical Scientist at the Center for Emerging Diseases at the National Institute for Communicable Diseases. Thank you so much for your time this afternoon. So according to the African Union Health Agency, we understand that over 18,737 suspected or confirmed cases of Mpox were reported in Africa, in fact, since the beginning of the year, including over 1,000 cases in 1 week alone. Just talk to us about the rapid spread of this disease and what the factors are.
Yes, so what we are starting to see with Mpox, the virus, monkeypox virus, is historically a virus that was not very transmissible from person to person. But as we see the outbreak ongoing over a number of years now, we are finding that the virus is adapting and becoming more amenable for human-to-human transmission. And that relates directly into the numbers of cases that we are seeing today. We are also seeing very directly the mobility of people across borders, and specifically the spread of the specific variant of the virus which has been circulating in the DRC to the Eastern African countries.
Just talk to us about these variants. I hear you mentioning, of course, that we do have different variants. We know there are some cases, not a lot, that have been reported outside of the African continent too.
Absolutely. So there's essentially, just to generalize, two variants that we can talk about. And it's the variant that has been associated with the multi-country outbreak, which has been reported since 2022, where more than 100 countries have reported nearly 100,000 cases over the period. And this includes also the situation that we've had in South Africa, where we've detected cases of Mpox in 2022, and again now in 2024. Then there's a different variant of the virus that has been circulating predominantly in Central Africa, with the largest number of cases being reported from the DRC. And it's now this variant, which has previously not been reported outside of the endemic countries, which is also now starting to spread outside of its original borders.
And I mean, we're just hearing, of course, that President Cyril Ramaphosa has commended the Permanent Representatives Committee for releasing $10.4 million from the COVID-19 fund to support the Mpox outbreak response. What does this mean in as far as vaccines are concerned? Will this mean that everyone in most countries that have been affected, particularly in Africa, will then get the necessary vaccines?
Well, it's good news for access to vaccines. With the WHO calling the public health emergency of international concern, and also the actions of the Africa CDC is certainly now forcing those hands urgently to respond. Especially in terms of the public health emergency of international concern, which is called as a mechanism of the international health regulations, really forces certain stakeholders to come to the party and will certainly aid in access to vaccines, but also improving capacity for laboratory diagnosis and also management of cases. So I think when a public health emergency of international concern is announced, people immediately think pandemic and they think bad news. But as a public health official, I hear good news, because it's bringing resources to the table, which we need to bring this outbreak under control.
And very quickly, Doctor, before I let you go, just talk to us again about just some of these symptoms that if you are in this country and, you get symptoms that we've been talking about. I'm particularly concerned about, that the symptoms may also start to change given the different variants. Just talk to us about the main symptoms that we all ought to watch out for.
So the virus is much more stable than something like SARS-CoV-2, which was the causative agent of COVID-19, just because of its genomics. So it's likely to change much slower than what we saw for SARS-CoV-2, where variants actually popped out quite quickly. So the symptoms should largely remain the same, and the most predominant feature of Mpox is the skin rash. It's a blistery rash. Some people may only develop a few nodules or vesicles, and might even not know that they've been affected with the disease, because it can be very mild. But we are particularly concerned for the presentation of this disease in people living with immunodeficiencies, especially those with unmanaged HIV infections, where they can then develop much more severe skin rash, which can also result in a life-threatening condition. Other systemic symptoms may include flu-like illness, which you would expect with most viral infections, but that's really not the predominant feature. And all cases of Mpox will develop some degree of the skin rash.
Dr. Weyer, thank you so much for your time. Really do appreciate it. That is Dr. Jacqueline Weyer, Principal Medical Scientist at the Center for Emerging Diseases at the National Institute for Communicable Diseases.